Assalamu alaikum wa rahmatullahi wa barakatuh. Today we will be talking about metabolic syndrome in brief, and this is done by me, Muhammad Tariq Al Muristani. Our objectives for this presentation will be the definition of metabolic syndrome, the epidemiology, etiology, and we will be talking briefly about diabetes and hypertension, and we will be ending this with the conclusion. Well, metabolic syndrome is a cluster of risk factors for cardiovascular disease and type 2 diabetes mellitus, which occur together more often than by chance alone. Those risk factors are raised blood pressure, dyslipidemia, raised fasting glucose, and central obesity. Metabolic syndrome is also known as syndrome X, deadly quarter, insulin resistance syndrome, and cardiometabolic syndrome. Recent studies have proved that metabolic syndrome is affecting more than one-third of the population in developed countries. World Health Statistics in 2012 has estimated the prevalence of hypertension to be 29.2% in males and 24.8% in females. The International Diabetes Federation reports that as of 2012, 366 million people suffer from diabetes. This number is projected to increase to over half a billion by 2030. 80% of people with diabetes live in developing countries, and in 2011, diabetes caused around 4.6 million deaths. Data from the World Health Organization suggests 65% of the world's population live in countries where overweight and obesity kills more people than underweight. Overweight is a BMI greater than or equal to 25. Obesity is a BMI greater than or equal to 30. For the diagnosis of metabolic syndrome, and according to the National Cholesterol Education Program, the presence of 3 or more of the following traits indicate metabolic syndrome. First, waist circumference, and it should be greater than 35 inches in women and 40 inches in men. Second, triglycerides, and it should be equal to or higher than 150 mg per deciliter. Third, blood pressure, and it should be equal to or higher than 130 over 85 millimeters of mercury. Fourth, the fasting blood glucose, and it should be equal to or higher than 110 milligram per deciliter. The last one is high density lipoprotein cholesterol, HDL, and it should be lower than 50 mg per deciliter in women and lower than 40 mg per deciliter in men. Some of the complications that can be caused by metabolic syndrome are cardiovascular disease and peripheral neuropathy. For cardiovascular disease, high cholesterol and high blood pressure can contribute to the buildup of plaques in your arteries. These plaques can narrow and harden your arteries, which can lead to heart attack or stroke. In peripheral neuropathies, nerves that carry messages to and from the brain and spinal cord from and to the rest of the body are damaged or diseased due to diabetes. Well, what is diabetes? Diabetes is a disease in which the body is unable to properly use and store glucose, and therefore glucose backs up in the bloodstream, causing one's blood glucose to rise too high. There are two main types of diabetes, 1 and 2. For the glucose values in the normal state, in fasting, it should be below 6.1 millimole per liter, and postprandial it should be below 7.8 millimole per liter. In the pre-diabetic state, in fasting it should be 6.1 to 6.9 millimole per liter. In the postprandial it should be 7.8 to 11 millimole per liter. Pre-diabetes means the patient is having abnormally high blood glucose with few or no features of diabetes. Diabetic patient state, if he's fasting, it should be more than 7 millimole per liter. In postprandial, it should be more than 11 millimole per liter. Common clinical features of diabetes are frequent urination, slow healing wounds, loss of sensation, blurred vision, and increased fatigability. Well, here is a summary table for type 1 and type 2 diabetes. First, type 1 diabetes onset is usually in the childhood, while in type 2 diabetes, it is commonly over the age of 35. Type 1 patients usually present undernourished and thin, while in type 2, the patients are usually obese. The prevalence for type 1 diabetes in comparison to the total diabetic patients is usually 5 to 10%, while in type 2 is 90 to 95%. Genetic predisposition for type 1 diabetes is common, but is less common than type 2 diabetes. Type 1 defects, the problem in type 1 patients are usually the absence of B cells, while in type 2 usually is the resistance of insulin in the tissues. Hypertension. Hypertension is a condition in which there is persistent increase in the arterial blood pressure. High blood pressure is classified as either primary high blood pressure or secondary high blood pressure. About 90 to 95% of cases are primary, defined as high blood pressure due to non-specific lifestyle and genetic factors. The remaining 5 to 10% of cases are categorized as secondary high blood pressure, defined as high blood pressure due to an identifiable cause, such as chronic kidney disease, narrowing of the kidney arteries. In 2007, WHO have revealed new values for blood pressure and hypertension. Normal blood pressure is considered when the systole is less than 120 mm mercury and the diastole is less than 80 mm mercury. Pre-hypertensive patient is when the systole is between 120 and 139 mm mercury and the diastole is 80 to 89 mm mercury. Hypertension is type 1 is when the systole between 140 and 159 mm mercury and the diastole is between 90 and 99 mm mercury. And type 2 is when the systole between 160 and 179 mm mercury and the diastole is between 100 and 109. And the type 3 and is considered emergent, the systole should be above 180 mm mercury and the diastole is above 110 mm mercury. In conclusion, metabolic syndrome is a combination of diseases including diabetes, hypertension, and hyperlipidemia. Metabolic syndrome is a very serious disease and it can cause death due to myocardial infarction. Metabolic syndrome prevalence is rising year by year, and the management of metabolic syndrome is essential and is done through managing the diseases related to it.